This sleep is a fascinating subject. There are so many aspects to it that I'm sure most of us have never given a moment's thought to, but fascinating indeed. I have an email question here from Dennis, and again, time is moving along. He questions about diabetes and its relation to a lack of sleep. Is there any connection that we make there, Dr. Ojo?
In diabetes, this is a common evaluation that we perform. There's the aspect, both reduction in sleep or sleep deprivation, as we sometimes is called, and also obstructive sleep apnea can both result in increasing blood sugars, and reduction in blood sugar control. So if we can, one of the things we'll tell folks frequently in the office is we can't cure what ails you, but we can help most things that ail you. So if we get their sleep under control, whether it's obstructive sleep apnea or lack of enough sleep, their blood sugars will be easier to control. It will not cure their diabetes, but it'll make it easier to treat it.
I think another issue is that when patients start to become restless and then wake up and feel badly, and known diabetics, checking the blood sugar is important, because this can be one of the early signs of a low blood sugar episode.
We have a caller, I think, wants to ask a question about that. Danny in St. Louis, go ahead, please, with your question or comment, Danny.
Yes, I got severe sleep apnea, and I sleep with a CPAP machine, and it's set on 18, my pressure, and most of the time when I wake up, I don't feel rest at all in the morning. I actually kind of feel like I've been out drinking most of the night, and I got a bad hangover. It's just like I can't think straight. When I get up, as the day goes on, I get more energy and start feeling better. But it's just like my brain's lack of a lot of oxygen.
Okay, anybody have a diagnosis?
Well, we need a little more information, and part of it would be how recently that the pressure has been evaluated to make sure it's an accurate pressure for Danny. What the machine does, continuous positive airway pressure, is it's actually a very elegant device in that it acts as an internal air splint to keep the person's throat splinted open. So if the pressure's not set accurately, and your needs can change over the course of your lifetime, he may be partially treated. The other aspect is we do know from some seminal work that was performed is that about 30% of patients, even when treated with positive airway pressure, which they need for their health, all the reasons we've talked about here today, for the atrial fibrillation and their high blood pressure and their diabetes, still may remain with a degree of sleepiness. So there is actually medications to assist with that in addition to the positive airway pressure. So that conversation would need to occur between Danny and his physician managing his pressure.
But it sounds like he should be talking to his doctor.
He should. It's a very common situation it's a good conversation to have.
I think that probably the most important part of continuous positive airway pressure therapy is close and frequent follow-up. Wouldn't you agree, Joe?
I would. I think that's, Stephen, that's one of the things we've been seeing more and more. People who come in, they haven't been getting followed up for a year, 2 years, 5 years, and they come in and say, well, I thought I needed to come back because I'm not feeling so well now. That ongoing conversation on a yearly basis at a minimum, even when doing well, is important.
With the sleep medicine physician.
Yes, I would agree.
All right. On the subject of sleep medicine, let's bring in Sophie calling from St. Louis with a question dealing with this. Go ahead, Sophie. You're on the air. Sophie, are you with us?
Oh, yes, I am. Good morning. I went through an intensive cancer therapy, and the doctor said the best way for me to recuperate was to sleep. And for 10 years, I have been on sleeping medication, and I asked my doctor, is there any other way to get through this without medication? And his answer to me was, if you had diabetes, wouldn't you take insulin? And I said, yes. And so he said, well, you need sleep medication to sleep, and if you don't sleep, you're going to have problems. And I've tried many, many, many times to go without it, with no success. Absolutely. I'm asking that, is that okay for the rest of my life to be on sleep medication?
We've got it, Sophie. Let's get a response from Dr. Lemon.
I think the important question is what medication? Because certainly it's the case that if the patient's on a medicine that in essence causes a withdrawal phenomenon, so that when the medicine is reduced, they have significant increased difficulty just because the medicine has been reduced, then that's a problem and has to be addressed with what's essentially a detox sort of approach.
Go ahead, Dr. Rojo.
Well, Sophie, first of all, on behalf of the three of us on the panel, we certainly hope for your good health and good success. I would agree with the concept. Insomnia needs to be viewed like other illnesses, which is that it's a chronic problem, and therefore sometimes chronic treatment is very appropriate as long as it's monitored closely by the physician and you're having the right outcome, meaning good sleep and good daytime function, and your medication's working correctly. That can be a very appropriate course of action. So it sounds like you're having close communication with your physician.
We are hearing a term that I had never heard before recently called sleep paralysis. What is that? It sounds awful. Dr. Rojo, I think you're probably the guy to go to on that.
Sleep paralysis is very simply, it's first of all, it can be normal, and it usually is normal for most folks.
What is it?
It's that sensation when people wake up, and sometimes what's happened is when you're in a thing called REM sleep, your
rapid eye movement,
your eyes move, and your brain is basically awake when we look at the EEG or the brainwave study, but your body's paralyzed theoretically, so you cannot act out your dreams. Sometimes in a transition, you will wake up before your body begins the ability to move again. So people perceive, and they rightly do, that they're awake, but they're not quite yet. Their muscles haven't gotten returned on and they can't move yet. And it can be very frightening for folks. So we have to reassure them. And most of us have had this experience at some point in our life.
You mentioned dreams. There's a whole program or two just in this subject. What about the role of dreams, Dr. Sheldon, in our sleep?
I think that's a very complex question.
Yeah, I'm sorry it's so late in the program to bring it up.
Because dream sleep is an imperative physiologic process that our body requires for both consolidation of learning, memory, and health and well-being, feeling alert and vital the next day. Children dream more than adults. They have more dream sleep than adults from birth through about 5 years. It is imperative, and if it's not obtained, the body will do its best to get it, just like the body would do its best to get sleep, because sleep is imperative. It is as imperative as food. The issue of sleep paralysis during dream sleep is as Dr. Ojal said, that it's to keep the body still while we are dreaming so that we don't act out our dreams. We have an active mind in a paralyzed body, where being awake you have an active mind in an active body. The sleep paralysis can also be indicative of other things. In the case of normal sleep paralysis, it occurs rarely. It occurs maybe once, maybe twice. But if it's occurring frequently, then it really needs to be investigated, because there are other reasons for sleep paralysis, and one of the main ones is narcolepsy syndrome, where sleep paralysis is one of the symptoms of narcolepsy, along with excessive daytime sleepiness and sleep attacks, hallucinations when falling asleep, and a condition known as cataplexy, where that muscle paralysis occurs suddenly during wakefulness, typically precipitated by laughing or giggling.
We have 1 minute left. Go ahead, Dr. Lemon.
At risk of oversimplifying, I tell my patients that if the night is like a football field, the goal line is dreaming or REM sleep. And one of the most important impediments to that, which Joe has talked about, is sleep apnea, because that repetitively blocks the touchdown.
We have 30 seconds left. On that subject, Pat from Bethalto writes, my father has sleep apnea. His cure for it has been to lose weight, and he's lost that weight. Does losing weight in 15 seconds cure sleep apnea?
It may help it. The anatomy of the posterior pharynx or the throat or the key, sometimes people, if they have a little extra adipose or fat tissue, it goes to the throat as well. If you lose it, it sometimes makes it go away, but it's not absolute. We have very thin patients who have obstructive sleep apnea and overweight patients who don't, but it does help.
We have to leave it at that.
Thank you.
Our time is up. Dr. Joseph Ogile, thank you for being with us. Dr. Walter Lemon, thank you for being with us. And Stephen Sheldon in Chicago, thank you so much for being with us. Fascinating
You're
discussion.
very welcome.